Doctors of Reddit, what is it like when you go to the doctors? I go in with my 1 to 2 complaints, succinctly give them the details that are relevant, answer their questions as able and take their advice on testing and follow through with the testing and treatment they advise. If I feel it is off the mark or I wish to have other testing done, I ask about it and see if it is appropriate. While only I know my normal best, my doctor is an expert. I seek out for guidance and help, and I value their advice and ideas. No doctor should treat themselves by themselves. It depends. It has its good and bad points. My original family medicine guy took a hands-off approach to management, physical exam and labs. It seems like he simply trusted me to do the right thing, but I kinda felt like we were going through the bare-bones motions to get my employee health points. The relationship fell apart when I injured my hand and went to see him. He was like, "It's just a sprain, I sit down, no x-ray." I didn't believe him, argued it, and felt a bit dismissed in the end, so I pulled strings and got an x-ray. The hand was broken, badly. I fired him as my personal physician for that one, because, who knows how long he would have kept letting me work with my injury. New doctor is tough on me and actually makes me answer to him regarding my lab results, cholesterol, sugars, ect. Definitely a no bullshit, no excuses approach, which physician patients are good at giving. I think I would rather have a physician that isn't afraid to treat another physician, than a wimpy doc that lets you get away with things, is hands-off and is too trusting. Edit, I have gotten a bunch of replies on the same thing. I apologize, since I typed the original story on a phone and tried to keep it shorter than it turned out. Clarification, I fired the original physician as my doctor and transferred my medical care to another doctor within my system. The doctor that made the error is still working, is young and has a long career ahead of him. I am sure he knows about the mistake, he got the transfer notification, plus physicians talk and errors are a favorite topic of scorn/put-downs. Hopefully, next time he just orders the x-ray up front, instead of the "let's see if it gets better" routine. Let's just leave it at that. Everyone is human and the possibility of making a mistake is always there. I face this issue in my own practice, every time I step into the hospital. I told my doctor that I had dislocated my shoulder about 15 times, I definitely should have seen a doctor earlier, but I just punched it back in socket and it was just sore, so I didn't, and he just said sure I did and sent me to physical therapy instead of checking. Where I promptly dislocated my shoulder doing exercises and got surgery for torn labrum, from a different doctor, that was at the edge where it is still absolutely fucked. The nurse was even trying to call bullshit while taking me to get an MRI and I was just like, yeah, I can't move my arm, so I lean forward so gravity lets it hang down, then punch my shoulder and it goes back in. I know the people in medical school. They aren't really that much smarter than everyone else, just ambitious and work hard, i.e. better families that have money and can pay for medical school and force the kids to study for like 4 hours after elementary school. I am double jointed and I have literally dislocated it, then popped it back in and finished playing a pickup basketball game multiple times, so I was probably too casual about it, but still, like I'm telling you, I have definitely dislocated it multiple times. I refuse to order x-rays all the time. You obviously have to look at each case individually and I certainly cannot speak to the case discussed here, but patients request x-rays for stupid reasons all the time. A patient may have a head injury and wants an x-ray of their skull when they don't realize a CT is what is really needed. If their skull is fractured, we have a lot bigger problems than them sitting in my office. Patients will step on a Lego and swear their foot is fractured when there's almost no possibility of it occurring. Patients love to request rib films without a history of trauma, regardless of the fact that even if a rib is broken it does little to change management. You don't get a lumbar spine film because you have a sore back for one day without a history of trauma. You might laugh at these examples, but these are requests doctors get all the time. X-rays should be ordered based on history provided in physical exam. Many people treat them as requests to see what's inside. Edit, someone asked elsewhere, is this an American thing? The answer is yes. Americans love to check labs and order tests with no clinical indication all the time. This happens because healthcare is so expensive in this country, patients feel as though they deserve more for what they are paying, despite the fact that that more isn't always better care. It's not unusual to have patients ask for absurd, esoteric labs with no clinical significance or indication because they read about it somewhere. Then if that lab result comes back as just outside the normal range, the physician is obligated to do something about a value that has no bearing on their health. The other reason this happens is because hospitals now treat patients like customers. The problem is patients aren't customers because the patient isn't always right. Meanwhile, I have the opposite problem. I have soft tissue-based problems with my muscles and joints and I can't get anyone to do anything more than an X-ray. I specifically say each time that there was no origin injury. The whole point of my arrival is that I'm tired of injuring myself during normal activity and want it to stop. You can x-ray my tailbone and hands, but you did that years ago and nothing was visible on the x-ray because I said it was a soft tissue thing and they already did blood work to rule out arthritis, Lyme disease, etc. An MRI may be more productive, but no one wants to try anything other than an x-ray because it's cheap. I even asked a Walter Reed rheumatologist when he ordered the x-ray, so if the problem might be cartilage wear or something, can you see that on the x-ray? No. Well, so if the x-ray doesn't show anything, what does that tell you / what course of action will it give? Nothing. Mental table flip. And I just stared at him with the open question of why bother doing it then on my face, and he looked away. Due to being a minor at the time, I wasn't able to seek alternative care. 10 years later, I still can't get my GP to consider anything other than PT as a treatment. I suspect it's Ehlers-Danlos, but that's a genetic test and no one will test me for it despite it being the best fit for my symptoms. I think the key is to just be as descriptive as possible. Specific locations, associations, etc. Too often I ask someone to describe the pain and they just say it hurts. Yeah, but does it feel like an ache? A stab? Sharp? Dull? Like fire? Like needles? There are a lot of descriptions you can use. Additionally, I want to know when it hurts. When did it start? Is it constant? Does it come and go? If it comes and goes, what is it associated with? And you can be more specific with where it hurts. Your belly is a pretty large non-specific location. Is it right under your rib cage on the right? Is it the lower area of your belly? How bad is it? The worst pain you've ever felt? Mild? So let's say I have appendicitis. Succinctly, I might describe the pain as tense severe sharp right lower quadrant pain that started and had constantly worsened over the past 6 hours, originally less painful and more in the center of my belly, now associated with vomiting and extremely severe if I try to move around, I'm bumped, etc. Then the doctor might ask about other associated GI/belly specific questions like pooping, eating, etc., and you can just answer honestly. I'm boarded in family medicine and my wife is a physician assistant. I own both my own practice and have a position as an employed physician. I guess you could say I am technically my own doctor, but that's only true in the sense of the insight I have into my own health and what warrants follow-up. I have been fortunate in that I have never needed a specialist. In all practicality, my actual doctor is my former junior resident from residency. I trust her and bounce anything concerning off of her and take her advice. I have many close friends in medicine and thus most of my interactions with other doctors is informal, but intensely respectful. I always approach colleagues formally and am invited to an informal relationship which I reciprocate. I respect their time, their career, and don't go in with too many expectations. I generally practice with the ethos that less is more and thus I don't expect unnecessary workups. I am just fortunate that my access is streamlined. I have not found caring for other physicians is too difficult. What is difficult is caring for their family who can act entitled or are sometimes very much mismanaged by their spouse in terms of care. It's difficult to tell the wife of a surgeon who put her on hydroxychloroquine as an outpatient for a mild cough and no confirmation of COVID-19 could be the reason she's having new onset palpitations. These are the types of situations I cringe to be involved in. Caring for physicians directly, we tend to do a lot less than the public seeks for itself. We understand the futility of many interventions. We tend to understand that more care isn't always better care. We are however able to quickly process and work up clusters of symptoms that could be serious. As one would expect, our precision in using resources is far better. Not a doctor, but my dad was. They don't go. Doctors hate to go to the physician. My dad would never go to get checked. We used to live in different cities, and 5 years ago he came for my birthday, November, and I was concerned he had lost so much weight. My dad visited my brother in the US for Christmas and it was very difficult for me to reach him. He wouldn't pick up the phone or return my text messages. A few days before New Year's Eve he called me and told me he was sick, he had cancer. My brother went to the airport to pick him up and Dad was in a wheelchair. None of his children knew he was sick. It turned out that he had been feeling bad and even passed out at work and he didn't want to go to the doctor. One of his employees took him and even threatened to talk to his children if he didn't do it. He said his doctor recommended to go visit my brother because the treatment wasn't available in our country, government doesn't care or provide medicines and the health system sucks. My brother and sister spent the holidays taking care of him. When he returned I went to visit him and stayed 2 weeks with him. My brother got him a nurse, and the guys that worked with my dad at my brother's business took care of him while I went back home to my husband and 5 years kid. 2 weeks later my brother called me crying because my dad was dying. I flew back to my dad, got there at night and he was gone in the morning. Please doctors, do take care of your health, your loved ones deserve it. If my dad had gone to get his checkups he would have found earlier and could have an opportunity to beat cancer. Not a doctor but a nurse. I'm always reluctant to share that as my specialty is mental health, not medical. I don't want doctors/nurses to assume I know a lot more than I do. I'm also fearful that I will be avoided more during a hospital stay. My husband is in and out of hospitals. Everyone knows that I am a nurse, it's in the record, it's part of handover because I don't volunteer that info. Now a few years ago, I was admitted to hospital and back on the ward. Post-surgery I wanted to go to the loo but I was hooked up to these 4 drips on both sides. I buzzed for a nurse and she said she would bring a pan. I said I don't want a pan. She left to get a pan. On return, I said I want to use the loo. She said that the doctor wrote in the notes that I am only to use a pan. I said I'm a registered nurse and I would love to see that entry because I have never heard of a doctor caring about how someone opens their bowels. She near shit herself. And I got to use the loo. So maybe there is an advantage to speaking up. Female U.S. attending physician here. I did telehealth with the dermatologist yesterday, as I have a dark black mole that's growing rapidly. They asked why'd you request this appointment? And I said I need a biopsy. They didn't ask me what I do, or what my background is. Talked down to me and called me dear, wouldn't let me get a word in edgewise. I shut up and let them hang themselves. 20 minutes later they say, well, dear, it seems you need to come in and have a biopsy. Not a doctor yet, still a medical student, but I always try to make it as easy as possible for the doctor I am seeing. I have 1 complaint per appointment and describe it as succinctly as possible. If there is something I'm particularly concerned about, I mention it, but I try not to diagnose myself beforehand because it's impossible to be completely objective. Also, having seen how the healthcare system functions, I don't mind if the doctor I'm seeing is running late. I've had quite a lot of experience as a patient, both before and after becoming a medical student. I'd say the only thing that's really changed is now I'm much more clear when describing symptoms.